All right, yeah, and thank you, Carrie, for the chance to for organising this and giving us the chance to come and speak today about the opportunities and challenges in Paralympic sport. So it's worth first thinking about the history of Paralympic sport and where it first originated, and it was actually just after World War II, 1948, when there was a doctor, Ludwig Goodman, who organised a sports competition for injured soldiers at Stoke Mandeville Hospital in the UK. And you see these amazing pictures of doctors in white coats and their patients with, throwing javelins out of their wheelchairs. And that's how it originated. Sport as rehabilitation was the start of it, which then grew into recreational sport and then into competitive sport. And the Stoke Mandeville Games evolved into the Paralympic Games over the course of the last kind of 70 years. And now we have the Paralympic Games as the third largest sporting event in the world. So nearly 4,500 athletes competed at Tokyo 2020 with a cumulative global TV audience of over 4 billion people. So it's a huge event. And I think the magnitude of the games is now the first opportunity that I wanted to talk about. And it's the eyes of the world on people with disabilities for a short period of time. But the attention that it garners is massive. And it's really a chance to showcase people with disability. The next thing I want to talk about is Paralympic classification systems. So classification systems are an opportunity because it allows us to have genuine, authentic competition. Classification underpins Paralympic sport. If we don't have classification, we don't actually know who wins the events. What classification does is it groups athletes with similar levels of disability together for competition, and it aims to minimize the effect of impairment on the outcome of competition. So the person who wins is the best athlete, not the person whose disability causes the least amount of difficulty in the sport. Yeah, I could talk about that a lot, but I'll keep moving on. There's select eligible impairment types for each sport, and each sport has its own classification system. Excellent. There's lots of other opportunities as well that we need to make the most of. So generally, I think what we're having is more inclusive attitudes nationally and globally. Certainly nationally in Australia, we have large sporting organisations which are tasked with managing inclusion through para sport. So Paralympics Australia and Disability Sports Australia are large organisations, and the Australian Institute of Sport also has its own para sport stream as well. We have such great expertise in both the health and the sports sectors. You know, we have some of the best health and medical practitioners in the world here in Australia. We also have amazing coaches, program managers, sports scientists, inclusion managers. So we have the expertise in patches. I think maybe perhaps we could do more to work together better at times, but we have the expertise, and that is another opportunity that we can capitalize on. We have the NDIS, which is increasingly being used to fund access to sports equipment and sports programs, even access to exercise professionals. So exercise physiology is fast becoming a great avenue into sport. And of course, we have Brisbane 2032. So the Olympics and the Paralympics will come to Queensland in 11 years. And that seems like a long way away, but now is the time to actually invest in the infrastructure for hosting the games, to really transform a city, really to make it the most accessible and inclusive games that we possibly can. So that is a huge opportunity in Australia anyway. So we've got all these great opportunities, but I don't think we're making the most of them yet. People with disability are still significantly less physically active than the general population, and overall participation rates in para sport are relatively low, depending on which data sets you look at. We also know that the games itself does not increase participation in physical activity or sport. There is no physical activity legacy that follows the games. So why is that? The reason for this is we have a lot of challenges. And I'll talk briefly about some of these. So we know there's real barriers to participation in physical activity for people with disability. And we know a little bit about the facilitators as well. There's actually been quite a lot of research in this area. We've got a lot of studies. These are good studies and even systematic reviews which pull together the evidence from kind of leaders in our field. We understand what the problems are. What we have less of is an understanding of exactly how to achieve safe and effective inclusion. And that is into the details of what programs are, what they look like, and exactly how we overcome the barriers. So that's the next step. I had classification systems as an opportunity, but it's also a challenge because there are real threats to the integrity of the classification process. It's a difficult thing to do. So evidence-based classification systems are now mandated by the International Paralympic Committee, but developing the evidence for those systems is difficult. It takes time and it takes resources. There's no substitute for a good classification system, but if it's not good, you don't have a valid competition. We also have intentional misrepresentation to tackle. So that is where an athlete can present themselves as having a more complex or severe impairment than they actually do at classification to try and be allocated a class against those with more severe disability than them. And it happens, it's a form of cheating. And we have to be able to detect when that's happening. And again, that's research that's required. We have to realize the incentive to cheat is so great now because the prizes are so large. We also have to just acknowledge that the classification systems are confusing. They're hard to understand. Each sport has its own classification system, and that can be a barrier to the viewing public. Another problem is the fact that we have classification systems means that many people with disabilities are not eligible to participate. I'm a classifier in athletics, and some of the most difficult conversations I've had is at classification explaining why people with disabilities are not eligible within the Paralympic system. It's a very difficult thing to do, and this is including highly prevalent neurodevelopmental disorders. So disorders such as autism spectrum disorder, DCD, ADHD commonly will not fit in the Paralympic system. And we need more systems and more opportunities across the spectrum of disability. Probably the most important for me at the moment is declining representation of athletes with complex disability. This is a real challenge for us. So we wrote about this recently in the conversation about why this is happening. And what this graph shows here is the number of events in one sport, just in swimming, for athletes with complex disability from Athens in 2004 through to Paris in 2024. And the blue bars there represent the number of events for those with complex disability, and the orange bars represent the number of events for those with least amount of disability. So there's always been a large discrepancy, far more opportunities for people with milder disability. But the most worrying thing is Paris 2024 will be the lowest representation in 20 years of people with complex disability, and the first games to have no events at all for females in the bottom two classes. So we need to address that, and we need to do that quite quickly. So what do we need? We need programs. I think we need lots of programs of individual, team, and multi-sport opportunities. We need to cater for those with complex disability at grassroots all the way through to elite levels. And we need avenues for classification, particularly in regional and remote areas. I think we need to bring back the direct link with rehabilitation. That it used to be there, that's how it started, but really we think about health and sport in relatively different realms at the moment. We need more research for achieving safe and effective inclusion, like I mentioned before. We need to understand more about the type and the magnitude of the benefits. We know that sport is generally a good thing, but we need to know exactly in what way and how good it is compared to other things that we recommend for people with disability. We need to understand the cost effectiveness and the risks associated. And we need to build expertise in how to create a supportive environment in parasport. And that's some of the work that CP Achieve is really leading the way on. We need education of health professionals. We need education of professionals in the sports sector. And of course, for people with disability and their families, so that they can capitalize on all the opportunities that parasport brings. And lastly, I think we need pathways. So we need the Paralympic movement flying the flag, moving things forward. And we also need investment in grassroots sport for all people with disabilities, so that those two things can meet in the middle and drive things forward. Thank you very much. I'll just finish by saying, there's a contact details here for CP Achieve. You can contact us via email at cpachieve@mcri.edu.au. You can also follow us on social media or visit our website. I'd also just like to say thank you to our funders, which is the National Health and Medical Research Council. So I think I will stop.